Hello, everyone. This is Brandon Holland, and I decided to make a video to supplement my diagrams for week four. So, this is week four's knowledge of systems and processes. And hopefully, the goal is to explain it better than I was able to illustrate it in the diagram. So, just getting started to keep it short. My aim statement I had to revise because I realized after looking over the notes last week and the feedback that I got back, I kind of understood that I had too many variables that I was trying to account for with the patient rated outcomes and time missed and other things. So what I did was I basically limited it to patient rated outcomes as it relates to the interventions chose to manage the injury. So the specific injury is lateral ankle sprains. So my aim statement is I want to determine the specific interventions for lateral ankle sprains can be used over the course of 3 years to create a significant increase, as determined by statistical analysis, in scores on the lower extremity functional scale in high school athletes with lateral ankle sprains in Prince William County. So basically, I didn't pick a percentage like I did the last time. Uh, just I want to see if we can create a significant difference as illustrated by statistical analysis. So my fishbone diagram, the problem that I want to address is the scores on the lower extremity functional scale associated with lateral ankle sprain. And I kind of modified the categories a little bit for the causes leading up to it. So my four categories are the clinician, which would be the athletic trainer, other people, the interventions, and also the nature of the injury. So under the clinician, you would see that you have treatment selection, as selecting appropriate or effective treatment would be done by the clinician. Their ability to instruct what the athlete or the patient should be doing would be paramount. Also, communication with the athlete, the coaches, the parents to ensure that things aren't being undone as they work away from the clinical site. Under other people, you have the patient. They have to, of course, adhere to the instructions and follow the instructions of the clinician. Coaches, their support or lack of support has an outcome, some bearing on the outcome. Then you have other healthcare providers that they may go see, maybe emergency room physicians or primary care physicians. Here at the bottom, you actually have the interventions that the athletic trainer may choose, which include therapeutic modalities and therapeutic exercise, rest, or combination of those three activities or interventions. And then you have the nature of the injury. And under the nature of the injury, you would have the severity. How bad is the initial injury? What's the history of the patient? Is this a re-injury or do they have some kind of medical predisposition to the injury? And you also have concomitant injuries. Is anything else injured in addition to the lateral ankle? You can have a ton of stuff under the nature of the injury and under all of these categories, really. But those are the four that I chose for this week. So my flow chart, essentially what we're going to do is we're going to collect the data for lateral ankle sprains and left scores. And we're going to do a statistical analysis on that data. And what we're going to do after the statistical analysis is we're going to identify the interventions that we believe are most closely associated with favorable left scores. And then we're going to reanalyze the new data and compare it to the old data. So under the flowchart, we are going to begin the category of collecting data for lateral ankle sprains and left scores. We'll identify patients first and foremost who have lateral ankle sprains, and then we'll obtain permission for those patients to participate in the study. We're going to give the patients a randomly generated ID so that they can remain anonymous while they submit data. And for those of you who know me, I'm a tech guy. I work a little bit on mobile applications for smartphones and tablets and devices like that. I'd like to develop an app that would allow patients to submit their data. So the clinicians would help, after they become familiar with the app, they would help the patients become familiar with the app. And essentially what the patient would do is they would submit a left score, a lower extremity functional scale score, at the beginning of their injury on day one, or as close to day one as we can get. And then every day that they come in to do treatment, whatever those interventions are, they would enter those as well in the app, and it would all be recorded and tagged to their user ID, which would be the randomly generated ID, over the period of 6 months. And at the end of the 6 month period, they would enter their final lower extremity functional scale score for this patient rated outcome. And what we would do after we got that final score is run a statistical analysis on the left scores. We would find the mean, because what we want to do is we want to associate, want to identify the mean left score and use that as our target. And then we'll identify the patterns that are associated with less favorable scores on the PRO. Separately, we'll identify interventions that are associated with more favorable, well, I have a misspelling there, more favorable scores on the left scale. And then what we want to do is isolate and target those interventions that are associated with more favorable scores. And if we can identify those patterns, if there's a pattern of scores that are common and people who have good outcomes, we want to focus on those. Next, we'll select and implement the targeted interventions with subsequent lateral ankle sprains. So after we've decided which interventions we want to use and which ones we want to avoid, every time we get a new patient, they'll come in and we will use the targeted interventions. So we'll implement the interventions based on the data from the previous step, and we will focus on including those associated with more favorable scores and also avoiding interventions that are associated with less favorable scores on the PRO. And then we would instruct the patient, the athletic trainers would instruct the patient to continue or discontinue the interventions as recommended by the ATC, but remind the athlete at the end of that 6 month post-injury period that they want to submit a left score via the app, via the mobile app. And after we have that left score, we would run a second statistical analysis. We would find the mean score for the second round of PROs, and we would compare it to the first round of PROs and identify any significant differences. Is there a significant improvement or a significant decline or neither? And from that, we would draw a conclusion. So for those who may not have had the that beastly statistics class, your significant difference will depend on several factors, including the formulas that you use, also the number of subjects that you have in the study. So all of those things would kind of affect significant difference. And so I chose not to pick a percentage again because I wanted to simplify it. And the significant differences, I think, is something that's reasonable in a short period of time, like 3 years. So that's all I have. Please leave me your feedback. I look forward to hearing everything that you all have to say, and thank you for your time.